Hello and welcome to Healthology Plus YouTube channel. In this video we will discuss piles and its treatment and prevention. Piles, also known as hemorrhoids, are a common condition that affects millions of people globally. It is estimated that nearly half of all adults will develop piles at some point in their lives. In this video, we will go over the causes, symptoms, and ways to manage and prevent piles. By the end of this video, you will have a better understanding of this condition and what you can do to alleviate the symptoms and reduce the risk of developing piles. Causes. Piles occur when the veins in the anus and rectum become swollen and inflamed. This can be due to increased pressure in the veins caused by straining during bowel movements or prolonged sitting. Constipation is also a common cause of piles. When you are constipated, you tend to strain during bowel movements, which can increase the pressure in the veins in your anus and rectum and lead to piles. Other factors that contribute to piles include pregnancy, aging, and a low-fiber diet. Pregnancy can increase the risk of piles because the growing uterus places pressure on the veins in the anus and rectum. As you age, the tissues supporting your rectal and anal veins can weaken, increasing the risk of piles. A low-fiber diet can lead to constipation and straining during bowel movements, which can also increase the risk of piles. Symptoms. The symptoms of piles can vary, but common ones include itching, rectal pain, bleeding during bowel movements, and the appearance of lumps near the anus. If you experience any of these symptoms, it is important to seek medical attention as soon as possible. This is because while piles are a common condition, there are other conditions that can cause similar symptoms, and it is important to get an accurate diagnosis to ensure that you receive the right treatment. Treatment. There are several ways to treat piles, including over-the-counter creams and ointments, warm baths, and lifestyle changes. Topical creams and ointments can help to reduce swelling and relieve itching and pain. Warm baths can also be soothing and help to reduce swelling and relieve pain. In severe cases, a doctor may recommend surgery to remove the piles. Surgical options include rubber band ligation, sclerotherapy, and hemorrhoidectomy. It is important to work with your doctor to determine the best course of treatment for your specific case. Prevention. To prevent piles, it is important to maintain a healthy diet high in fiber to prevent constipation and straining during bowel movements. Eating plenty of fruits, vegetables, whole grains, and legumes can help to ensure that you are getting enough fiber in your diet. Staying active and avoiding prolonged periods of sitting can also help to prevent piles. Regular exercise can help to improve circulation and reduce the risk of developing piles. If you have a sedentary job, make sure to take breaks and stretch regularly to avoid prolonged sitting. This will help to reduce the pressure on your veins and reduce the risk of developing piles. Lifestyle changes. In addition to dietary changes, making certain lifestyle changes can also help prevent piles. Quitting smoking and reducing alcohol consumption can help reduce the risk of piles. Smoking can damage the veins in the anus and rectum, while alcohol can increase inflammation and increase the risk of developing piles. Staying hydrated is also important for preventing piles. Drinking plenty of water can help to prevent constipation and reduce the pressure on your veins. It is also important to avoid straining during bowel movements. If you are constipated, try to use the bathroom as soon as you feel the urge to go. This will reduce the need to strain and can help prevent piles. Conclusion. In conclusion, piles are a common condition that can cause itching, rectal pain, bleeding, and the appearance of lumps near the anus. There are several ways to treat piles, including over-the-counter creams and ointments, warm baths, and lifestyle changes. To prevent piles, it is important to maintain a healthy diet high in fiber, stay active, avoid prolonged periods of sitting, quit smoking, reduce alcohol consumption, stay hydrated, and avoid straining during bowel movements. If you experience any symptoms of piles, it is important to seek medical attention as soon as possible to ensure that you receive an accurate diagnosis and the right treatment. Thank you for watching this video on piles and its treatment and prevention. If you have any questions or concerns, please don't hesitate to reach out to your healthcare provider. We hope that this information has been helpful and that you have a better understanding of piles and what you can do to manage and prevent them.